of this presentation is not to denigrate Nigeria, but to compare the healthcare system. Nigeria, a little history of Nigeria. Nigeria was formed in 1914 by the British, and they became independent from Britain on October 1st, 1960. Their government is similar to the United States, with a president, Senate, House, and a judicial system, and they also are a federal republic. Nigeria has the highest population in Africa, with over 140 million people, of which 40 million are children under the age of 5. They are located in West Africa on the Gulf of Guinea. Bordering countries are Niger, Chad, Cameroon, and the Benin Republic. Their population growth rate is 2.382%, and the median age is 18.8 years for males, and for females it's 18.6 years. Their literacy rate for males is 75.7%, and for females 60.6%. The economy over Nigeria, 95% of the country's export income is made up of petroleum and petroleum-related products. The petroleum industry is privately owned, so it's created a huge gap between individuals with a lot of money and no money, and it's a small group that owns that large portion of money. Cocoa and rubber make up the other 5% of their export income. It is estimated that 66% of Nigerians living below poverty level, and about 67 to 90% of their income is spent on food items. The gross domestic product per capita is $2,200, and comparing that to the United States, the gross domestic product for U.S. is $46,900. So now onto the healthcare side of things. Communicable diseases such as malaria, tuberculosis, diarrhea, HIV are very dominant over Nigeria. They have what is called a primary health care center, which is the cornerstone of their healthcare system. They developed that in 1987. It is a government-run center, and they are used primarily to prevent the spread of these communicable diseases. The treatments for illnesses were traditionally through natural remedies. However, more common is now using both natural remedies and industrialized medicines. And the 3 levels of care set by the Nigerian National Health Policy are primary, secondary, and tertiary. Similar to the United States, the healthcare costs are rising in Nigeria. So to help prevent the increasing costs, the National Health Insurance Scheme was put in place. It's an Act 35, which was passed in 1999. Their goal was to improve the health of Nigerians at an affordable rate. The National Health Insurance Scheme, employees of the public and private sector employing 10 or more people are eligible for this insurance scheme. Participants can choose which health center to register at, and their expenses generally shared between the employer and employee, 10% employer paid and 5% employee paid. However, the employer can choose to pick up the employee's 5%. To give you an idea of the cost, monthly average cost for malaria treatments is US dollars, $7.03. Doesn't seem like a lot, but remember, more than 60% of Nigerians live below poverty level, which is $1.25 a day, US dollars. So I believe it was around 20% of their income is being spent just on malaria treatments if they happen to have malaria. And government spending for healthcare is only 1%. The quality of their healthcare, the National Health Insurance Scheme has a comprehensive package, and they're very similar to a lot of packages here in the U.S. where they have outpatient care, prescribed drugs, maternity care, preventative care, consultation with specialists, hospital care, eye exams care, and preventive dental care. There are not enough skilled health professionals in Nigeria, So it makes the quality of care an issue. Only about 35% of the births over there in Nigeria are attended by a healthcare professional. The other, they're on their own, or they have friends, family help them. With the introduction of managed care and HMOs over there, there has been an increased demand for improved quality of care and services for their members. And there's also the Society for Quality in Healthcare in Nigeria. There was a non-government organization which was established in 2006, and their goal was to improve the quality of care in Nigeria. So similar to the United States, there's quality control measures in place to help improve over there as well. Similar to the US, access is available to everyone, however, it's not always affordable. And so that limits individuals from utilizing the care. And access to care is also provided in the form of charities. For example, there's a US-based Starfish Project is the name of the project. Their mission is to collect unused prescription medication of American AIDS patients, and they provide it to Nigerians who have AIDS. And they realize it's a small difference, but it's one person at a time. And the project was developed because someone was going along picking up starfish along the beach, throwing them back into the water, and someone asked them, why are you doing that? It doesn't make a difference, just one starfish. And the guy said, well, it's one starfish that I'm making a difference for at a time. So that's how this project kind of, the fruition of the project. For innovation in Nigeria, they have the services availability mapping, and it helps identify inequities in the distribution of the health resources. Patients are able to call up this SAM and report any quality issues they may have when they go visit. They also have funding opportunities through grants, which is the Accelerated Child Survival and Development. Their goal is to reduce the number of deaths in children 5 and under, and they provide incentives to mothers to be seen at the clinic during their pregnancy and thereafter. Some of the incentives are free mosquito nets, nutrition education, and home remedies for